It's Dr. Rachel Brown, Medical Director of Prevention and Wellness at Business Health Solutions at Prisma Health. And this is your monthly health and wellness update. We're going to be spreading these out so that we send these out to you every month. And we're going to change it up a little bit. We will, of course, update you on any developments related to COVID, but we're also going to include other health and wellness topics that you all are asking for. So let's start with our COVID update. The good news is in South Carolina, we're seeing the lowest disease burden rate that we have in the last 15 months. There is still plenty of testing being done in order to get a good sense of what the disease burden is. And it looks like our percent positive has been in less than 2% over the last several weeks. And this is even since the relaxed, mask mandate and other changes within the schools over the last month or so. So we're doing a really good job here in South Carolina. In terms of vaccination, which of course is a huge part of mitigating this pandemic and the spread of the disease, we're really not gaining a lot of ground. So what I'm going to do with you is share the vaccine dashboard that DHEC supplies, and we're going to see that since the last update, there really hasn't been much of a change. So there was around 35% of South Carolinians who were fully vaccinated a few weeks ago. We're now up to closer to 39%. This number has stayed pretty much the same, 45 percent of residents, 46% of residents who have had at least one vaccine. This is lower than the national rate. The national average is about 51, 52%. And we're still not at those numbers that will give us the complete sense of security that we would with typical herd immunity sort of numbers. But let me give you some very interesting statistics around vaccine perspective. And so since last May, there's been a national study done that's looked, and this is across the country, not just in South Carolina, but just has looked at folks' willingness to get the vaccine. And around 15% of the population says no, they will never get the vaccine. And that really hasn't changed. It's fluxed between 12 and 15% for the last 9 months or so. And then another 9-ish, 10% of folks say, I would only get it if it were required. And of course, we know the stickiness around requiring this vaccine at this point. So that's about a quarter of the population that really isn't going to budge, is not interested in getting this vaccine. However, the number of folks who said they may get the vaccine, they're thinking about it, or taking kind of a wait and see approach has really shrunken. That was around 35, 40% before. It's now hovering around 12%, which is pretty impressive. The details, though, around that are that when you start asking that group of folks, more details around their wait and see approach, we find that most of them want to wait until the FDA fully approves the vaccine, and that they really want the vaccine to be out there for a year or more before they decide to take it. So that's why we've seen this stall. That percentage of the population that has not gotten the vaccine yet, but that is considering it, is still waiting for more time. So we're likely to not see our vaccination numbers climb much more than they have now. And so this gives you an idea of what you need to work with in your businesses in this point in time, and probably going forward for the rest of the year. The other really interesting information I want to share with you is research that's come out about the vaccines themselves and how effective they are, and more of an understanding around natural immunity versus vaccine immunity. And some of this information could be really helpful to share with folks that you know, whether that's employees, family members, colleagues, friends, community members, who are wondering whether this is right for them. And maybe we can get that 12% number down even lower, and get us to that 60, 70, 80% of South Carolinians and Americans who have immunity. So one of the things I'd like to share with you is that they're doing more studies around what's the total immunity of a population? And what that means is not only immunity from the vaccine, but natural immunity from having had COVID before. And the preliminary data around folks who have natural immunity is that they feel like it's lasting somewhere between 7 and 11 months. And the only reason they've stopped at that 11-month mark is because that's when they started studying folks in the early stages of the pandemic who became infected. So it's not that we know after 11 months that someone with natural immunity no longer has natural immunity. It's just that we haven't been able to follow this any longer than 11 or so months, a year or so, to know. But it does look promising that folks who have had the COVID virus do have natural immunity that does last them quite a long time. And when epidemiologists are looking at herd immunity, they're factoring in those folks who also have natural immunity. There is a presumption that in South Carolina, we have about 35-ish%, 38-ish% of our folks who are fully immune thanks to the vaccine. And then possibly another quarter of the population, maybe a third, that's immune due to natural immunity. So that gets us closer to that 60-70% mark, which is important. However, we still encourage all folks to get the vaccine, and here is why. I'm going to stop sharing my screen for just a moment. Many fun pieces of information here to help support why vaccination is so important. And the first is that we know our vaccines are effective against the variants. And if you've been paying attention, variants Alpha and Delta, which are the variants that arise from Great Britain and India, are becoming more and more prevalent in the US. And so we want to know that our vaccines are going to be effective, at least partially, against those variants as well. And what's important to understand about natural immunity is that folks who have had COVID and developed natural immunity are only immune to the strain that they were infected with. So if they were affected with the original strain of COVID, they are not necessarily immune to those variants. The next one is that they're finding out that that natural immunity from having had a previous COVID infection is not as great in folks who are greater than 65 years of age. And we know that our older population is more at risk for complications from COVID. And so if they do not mount the same strength of immune response when they have the infection, they really still need that vaccine. They're at higher risk. They need more of a boost to their immune system. The other study that's come out that's been really interesting has shown that folks who were infected with COVID at any age, who had natural immunity, who also got the vaccine, had even more of a successful and effective ability to ward off infection. So even for folks less than 65 years of age who have had COVID, getting the immunization on top of that natural immunity is incredibly effective and compounds the ability to mount or that immunity that you have and lowers your risk of getting infection. The other thing is there are folks out there who tell me, well, I've had COVID. I wasn't really diagnosed, but I know that I had it. And so I don't need to get the vaccine. Well, they did a very interesting study to look at how accurate folks were in determining whether they had COVID without an actual COVID test or official diagnosis. And it turns out that we are not very good at guessing at whether we had COVID or not. When they took folks who said, yes, oh, I know I had it. I may not have tested positive, but I know I had it, and look for antibodies. More often than not, those folks did not have antibodies to COVID and had not had COVID before. So we can't really trust our judgment on that one. And then the last really interesting information that could serve as a motivation for folks to get the vaccine, especially folks who've had the infection already and are wondering whether it makes any difference to get the vaccine, is that we know that long haul COVID, or symptoms that stem from having a COVID infection that are lasting for months and months and months and months and really affecting quality of life, is improved with administration of the vaccine. And so we have tons of data that shows folks who, and scores of anecdotal reports, folks who were really suffering, fatigue, shortness of breath, foggy brain, after having a COVID infection for months and months after the infection was gone, they have gotten the vaccine and they feel much, much better. So there are lots of reasons still to get this vaccine, to protect against variants, to protect folks who are older, who may not have mounted as good a response to a COVID infection, and to protect against long haul symptoms as well. Now, here's what we're seeing in terms of infections. As I said, the rates are much lower, but when you look at the pool of folks who are unvaccinated and compare the percentage of cases to just that group of folks, the rate actually goes way up. And if you think about it, this makes sense. If we're looking at how many COVID cases there are across an entire population, there are much fewer now. But if we eliminate the vaccinated folks from that equation because they cannot get infected, they are protected from the virus, the percentage of infections within that smaller unvaccinated population essentially doubles, since half of our population is not vaccinated. And so while we are definitely seeing the impact of our mitigative factors such as masking and social distancing and getting vaccinated, at decreasing these cases, if you are among the unvaccinated, your risk is actually theoretically higher. It is now the unvaccinated who are spreading the disease to other unvaccinated folks. And so as you tighten up that group and that pool gets smaller, that's going to be a higher risk for those folks. Also, because we know, and studies didn't need to show us this, but they do, that with the relaxing of the mask mandates, folks who are unvaccinated have started unmasking as well. We did rely on the honor system for this, and some folks are just tired of wearing their mask or never believed in wearing masks and have taken them off. And what that has done has if they're unvaccinated, has put that group at higher risk. And so we are seeing a little boost of infection rates because of that. And then when you add in the fact that the circulating variants are much more infectious, they're more easily transmitted, you're really putting together a circumstance for unvaccinated folks that can be very, very risky. So we encourage unvaccinated folks to continue to consider getting the vaccine. Ask the questions you need to ask so that you feel comfortable getting the vaccine. We encourage unvaccinated people to remain masked because those variants are out there, and they are much more easily transmittable. I do want to review very quickly what testing and quarantine procedures for folks who have COVID, because we've kind of moved away from that as we think about being safer. But the reality is we still are seeing folks infected with COVID. And so if someone has the typical symptoms, of course, we don't want them in the workplace. We don't want them out and about in public places. We need them to quarantine until the results of their test come back. If their test is positive, they still need to isolate for 10 days. That has never changed, even regardless of the case burden being so much lower now in South Carolina. If, in terms of exposure, an unvaccinated person is exposed to COVID, they still fall into those three strategic quarantining guidelines, either quarantining for 14 days, quarantining for 10 days, or quarantining for 7 days as long as they have a negative test on day 5. However, if someone who has been vaccinated is exposed to someone with COVID, they do not need to quarantine at all. They just need to watch for symptoms. So that has not changed, although as we become more comfortable with COVID, and the lower rates of cases we've seen, the lack of masking, we kind of forget that there still are those rules for folks that are exposed or who are infected. All right, I am going to stop there and move to our health and well-being topic of the day. And given that this is our first of our monthly series where we'll be addressing things outside of COVID, I really wanted to focus on emotional and mental health because most of you have been reaching out to find out about what to do now that we're entering this new normal. And so there's a few tips that I have for you today, but please know that we offer emotional and mental health programming and services and would love to help you. Please reach out to Business Health. I'll show you how to do that at the end of the webinar, or excuse me, the update. So there are a few key things that you'll hear psychologists say as we begin to re-enter the workplace, re-enter society, feel more comfortable about this pandemic being under a little bit more control, although we aren't there yet. And the first is they recommend do not assume everything is going to go back to the way it was. So with your employees even, I encourage you to send the message that while you are striving to get back to a more normal situation, a more predictable and familiar situation, that there may be things that have changed more permanently. And I encourage you to work with your leaders and work unit leaders and representatives to think about what could look differently. This is a perfect time to start thinking outside the box and combine what we've learned over the last 15 months with what you're trying to get back to accomplishing. And maybe there are better systems and efficiencies that you all could put in place. And ask for your employees' input on this one. Everyone has been disrupted, even if work continued as per usual for you and your organization. And with that disruption comes creativity, outside of the box thinking, and innovation. And so you may find from every corner of your organization, not just leadership, really great ideas on how things may look differently now, even as we go back to not feeling as skittish about COVID. Obviously, one of the most obvious examples is virtual meetings versus in-person meetings, and the ability to share information electronically versus by word of mouth, or even typical kind of emails or bulletin boards and that kind of thing. But in your organization, you may find many other areas where things have changed for the better, and keep those. But again, seek input and hear all voices. That's going to really help folks to feel invested in this transition and help with their emotional and mental health as they ease into that, and as well as serve as a participant in that process. The other one is to express and show patience for everyone. Remember that each individual and each organization is trying to weigh its own risk, and there are not hard and fast rules on the best way to approach unmasking in the workplace, relaxing social distancing requirements in the workplace, what to do with folks who may feel ill, what to do with exposures. All of that is in such a gray area at this point. People are consistently reevaluating their risk, and there may be those who are more concerned, and we need to be patient. There may be those who are more frustrated and want relaxation of these mitigation strategies, and we need to be patient with them as well. You have to decide for yourself what your risk is and what your organization, what your family, what you as an individual feel comfortable with, but understand that everyone is going to have different feelings about that. And we need to talk and express those feelings in a psychologically safe place. Which leads me to the next recommendation, and that is to set up opportunities for your leaders and your employees to talk about what life has been like for them, even if it's just a session where they express what they lost over the last 15 months, or maybe what they learned over the last 15 months. But give folks an opportunity to talk about it, regardless of how resilient your organization may be. People are ready to vent off what has been happening over the past 15 months. And in that process, whether those are small group sessions, whether those are blogs, whether those are, sentiments on a bulletin board, whether those are leader-led work unit interventions, in those sessions, not only will you allow your employees and your organization to find a sense of relief, But you will also be able to identify who might need a higher level of intervention and engagement, say with your employee assistance program or with programming that we can offer. And at this point, many people just have their heads down and are trying to get back to it. But people are still struggling. And if we're not asking and we're not listening and we're not paying attention, we're going to miss that. We're going to miss opportunities to help folks. So take the time to engage with your workforce so that you can determine how they're doing and just give them that opportunity to vent off some of that steam. The last recommendation is to set boundaries. What has happened over the last 15 months is more of a blurring between boundaries, or more of a blurring of boundaries between personal and work life than ever. And that can be very, very dangerous to emotional and mental health. So we each as individuals have to set boundaries that we are comfortable with. And those boundaries may look different than the person next to us. So communicating those boundaries is key. I'll give you a great example. There was a colleague of mine who at the bottom of her email said, to balance my work and personal life, sometimes I have to answer emails late at night. Please do not think I want you to respond to my email late at night either. This is just my path. That is how she has chosen to balance work and life. You may decide your evenings are yours and you don't need interruption from work, and vice versa. If you're working from home, your days are your working time and you can't be interrupted by your family during that time. But communicating those boundaries will be key as an individual, but I also encourage you to get your leaders to sit down with their work unit and do the same thing with their work units and really determine how to find that balance and what's acceptable within that work unit and what is not acceptable within that work unit. All right, I just want to share my screen one last time with you. We are here to help you because we know that coming out of this situation, there are going to be a lot of new paradigms for every different organization. Some of you may be wondering, how do we get to a place of being unmasked? Some of you may be wondering, how do I support my workforce? They're exhausted and tired. Others of you may still be wondering what to do about COVID exposures. We're here to help you with that. Please watch these videos. Please share these videos with your workforce. Send them the links. Let them get this information so they know as much as you do. And if you have questions, please use this number so that we can talk about what it is that you need to make sure that your workforce is happy and healthy. And of course, since we're adding in wellness topics each month now, please reach out to us and let us know what you'd like to hear about. Next month, I'll be talking about working through these wellness dimensions, which is an incredibly important and easy way to start getting a sense of where you are in your total well-being. In the meantime, we'd love to hear from you, and just know that we're here to help you so that you can support your workforce, and I'll see you next month.